I'd like to take the time to talk about ligaments of the face and how that relates to dermal fillers and anti-aging. Understanding the ligaments of the face can help us understand facial aging and appropriate rejuvenation techniques. These ligaments are found between different fat compartments. Ligaments are often released during facial plastic surgery procedures, and they also play a role with the non-surgical rejuvenation approach. As many other anatomical structures, ligaments often have more than one name for the exact same structure. Retaining ligaments are strong, fibrous attachments that originate on the periosteum or deep facial fascia and insert into the dermis. Retaining ligaments anchor the skin and superficial fascia, the SMAS, to the deep fascia and bone. Both the retaining ligaments and subcutaneous fibrous septa create separate zones dividing the face into the superficial and deep compartments. There's a lack of consensus to which ligaments are considered true retaining ligaments. However, many consider that true retaining ligaments originate from the periosteum and insert directly into the dermis, such as the zygomatic and masseteric retaining ligaments. Other ligaments that do not insert directly into the dermis still have a direct effect on the SMAS, an indirect effect on the dermis through the retinacular cutis, which are multiple small fibrous bands that extend from the deep dermis to the underlying deep fascia. In our temporal and frontal area, that temporal region, there is an adhesion zone medial to the superior temporal fusion line called the superior temporal septum, where the gallia and the periosteum are fixed to the bone. The orbital ligament can be found distal to this area at the level of the superior lateral orbital rim. In the frontal region, neurovascular bundles actually stabilize the tissue here. In our periorbital area, the orbicularis retaining ligament is located at the level of the palpebral malar groove. It's a narrow band between the superficial and deep fascia that runs inferior and lateral along that orbital rim. The orbicularis retaining ligament originates on the periosteum and inserts into the skin at the lid-cheek junction. It's a ligament that fans out and runs through the orbicularis oculi and the SMAS of the skin, similar to the reticular cutis. Medial to this ligament is the tear trough ligament located at the level of that nasal jugal groove. The tear trough ligament is inferior medial to the orbital rim and originates at the maxillary periosteum, which is the bone of the upper jaw, separating the palpebral and orbital portions of the medial orbicularis oculi muscle. It is continuous with the orbicularis retaining ligament and terminates at the level of the medial corneal scleral limbus, which is the junction of the cornea and the sclera. The lateral portion of the orbicularis retaining ligament terminates at the lateral orbital rim, where it thickens and directly connects to the lateral canthal tendon through the orbicularis deep fascia and tarsal plates. Superior medial to it runs the orbital ligament, which is closer to that temporal area. In our cheek and mandible, we have the zygomatic cutaneous ligament, which is found posteriorly along the arch of the zygoma and is considered true ligaments due to their attachment from bone to dermis. Our masseteric cutaneous ligament arises from the masseteric fascia over the anterior border of the masseter. The mandibular cutaneous ligament arises from the anterior third of the mandible and inserts into the dermis. With age, patients often develop a prejowl sulcus at the level of this ligament. The platysma auricular ligament arises from the parotid fascia and anchors the posterior border of the platysma to the preauricular skin, anteriorly and inferiorly. I also want to talk about nerve branches and their relationship to retaining ligaments. Part of facial plastic surgery often includes the release of facial ligaments. Understanding facial ligament anatomy and the spatial relationship ligaments have with facial nerves helps the surgeon avoid nerve injury. When it comes to aging and retaining ligaments, facial aging is often a result of soft tissue descent and loss of volume and loss of tissue elasticity from repetitive motion. There is little consensus to the role of ligaments on the aging process. Some theorize that there may be laxity in the retaining ligaments, while others say ligaments stay strong, but the tissue between it becomes unsupported and descends with time. With either theory, what is visualized with age is that the regions or grooves where the ligaments lie tend to be more pronounced. With aging-related volume loss, many areas at the level of the ligaments become more apparent. Revolumizing at the level of the ligaments can better support the tissue in these areas, giving a more youthful appearance. One article I read, called The True Lift Technique, Facial Ligament Retightening and Anatomical Approach by Dr. Peter Huang, suggests revolumizing with 0.1 to 0.2 hyaluronic acid filler boluses at the level of the four major retaining ligaments, which is the orbital retaining ligament, zygomatic retaining ligament, buccal maxillary retaining ligament, and mandibular retaining ligament, to help retighten the ligaments and give a more natural appearance post filler. If you like this content, please like and subscribe. And if you have any questions or want me to elaborate on anything, please leave a message in the comments below.